It's Dr. Karthik Ram. Welcome to my podcast. I'm a board certified plastic surgeon and educationalist based out of Chennai. I'm really honored that you have taken your time and given me your gift of your attention. Hope you are going to love this session. Please follow me in my Instagram handle for more updates. My Insta handle is Ram Dr. Karthik, RAMDRKARTHIK 2.
Hello everyone, I am Dr. Joyce Jesudas, currently a fellow at Chennai Plastic Surgery under my mentor Dr. Karthik Ram. I always thought as plastic surgeon, the operation theatre is an interesting arena, lots to learn, lots of experience. But little did I know that the outpatient interaction could be fascinating as well. So Dr. Karthik and I bring to you a weekly update of our interesting patient experiences, as we call it, the diary of a plastic surgeon.
When Joyce told about this idea, I was totally agree with her and how many interesting clients we see in our practice every day. And just recording our experience will help a lot of young plastic surgeons to understand cosmetic surgery specialty, as well as it is, it's nothing but a diary of a plastic surgeon actually. Hope it will be interesting for you as well.
Sir, I'm sure you must have operated at least close to 3,000 gynecomastia cases.
Yeah, see, the from the beginning of my career, my the gynecomastia case load is very high, and we have crossed more than 3,000 at this stage. And but every time we see a lot of interesting questions from the patients attenders. So this week, one of the patient asked an interesting question I never heard of in this last 3,000 questions. He asked me because I'm going to go abroad for studies, and I'm worried whether the metal detectors will detect anything, or the X-ray when they take it will show something about my surgery, gynecomastia surgery, the male breast surgery. So he worried about the X-rays. Like there will be any clips or something, so it will be visible in the chest when they take the X-ray. So this is the first time I'm coming across this kind of a question. We have to make them understand we don't keep any metals inside when you're doing a gynecomastia surgery, and there won't be any problem in the immigration. So don't bother about it. That's what we need to make him understand.
Yes, Dr. Karthik. It's been at least close to 6 months that I've been with you, and I'm so used to answering the routine questions that we hear from all the patients who come for a gynecomastia operation. But this time it was very interesting what this person had to ask us, and I'm sure you satisfied them by giving a very appropriate answer.
Actually, not only this, we come across so many questions in gynecomastia. So only we put almost 60 question and answers in a video so that people will be completely answered with all their queries. But still, we come across something very new and every week in
This
gynecomastia
caught you by
consultations.
surprise, I'm sure.
Yeah. So other patient you remember, Dr. Joyce, the patient who came with obesity issues, and this patient, as you we actually we discussed about this case in the OP the day also. She came to me 3 years back with the same problem to reduce the weight. I told her that reducing the weight in her hand, she has to cut down the carbs and do regular exercises and reduce the calorie intake. And uh, then only she reduced weight. And I turned down the reason why they came for liposuction that time also. This time also they came for a liposuction. Mother, daughter, and son. Three of them came for a liposuction. Mother, this time also the reason why they came is for liposuction. The reason is because they want the girl to get married. I feel really bad because the son is also obese. They never bothered about the son. Basically, they want to sell the girl in the marriage market. That's really bad in the situation in our country. And that time also, mother is not really understanding. We have to make the kid, both the kids, healthy. So we make both of them set and make both of them understand why they need to be healthy and why they have to follow diet and exercise to reduce the weight. That liposuction is not a solution for them. So so we need to clearly turn down the inquiries for liposuction when they want to reduce weight. We have to make them understand liposuction is not a weight reducing procedure. It's just a body contouring procedure. When they lose weight, uh, but still some areas are not resistant to the weight loss, then we need to do a liposuction on the areas where it is resistant to the diet and exercise. And some people say it's like it's whole family is obese. It's something familiar. I always say it's not familial. The way a family eat at the home.
Yes,
That's a major reason for the weight gain. So if end of the whole consultation, they also realized, and the girl promised that I lose 10 kgs and come back to you after 2 months. That's what they promised. They made me and went. We'll see.
those of us who have siblings, I'm sure we're always used to being pulled. But this was very interesting where one sibling was constantly consulting, I mean, talking about the sister being obese, but did not realize that he himself was too. And it was very interesting the way Dr. Karthik educated the entire family, made the mother realize that though the daughter had to get married and it was an urgent cause why she needs to reduce weight, but the entire family needed to change their diet routine and needed to get a little more healthy. Uh, there was another interesting thing which happened. We see a lot of regular patients come in, but we had one actress who brought her sister. I'm sure Dr. Karthik could elaborate more about this.
This, yeah, actress X had a tummy tuck procedure in Canada. Basically, she is a Canadian citizen, and so but they finally end up with a complication of abdominoplasty. She had a big wound in the tummy. This is probably 3 years back.
Okay.
She contacted one of her friend, other actors is my client. So she referred her to me, and she sent the photograph from Canada itself. And she's supposed to go into a one big kind of commitment in the cinema industry in Tamil Nadu. She was worried whether she can go back in 20 days with this big wound like this, and she messaged me from there, and I promised her, okay, I put my full effort to make sure that the wound heals faster and go back to the go to the commitment in the scheduled planned time. So
So
she
if I
came.
remember right, she came all the way from Canada with that wound to
Wound.
you here.
Yeah. She
And you
also,
helped her out, and
yeah,
within 20 days made her ready to go for that
yes.
commitment.
What we did is we did that vacuum assisted closure, and it
Okay.
really helped. And she recovered very fast, and she went to that commitment without any issues. And she was so much appreciating our effort, what we did for her. So that's why she brought her own sister for the tummy tuck. Here she is also from Canada, so she came down from Canada for the tummy tuck to us. So that's the trust, like what we are building with the patient. You help a patient, make them happy, they are your brand ambassadors. The marketing is secondary. You do not do any marketing activity, they market for yourself. That's what we are understand.
Yes, this patient, more than a patient to us, has also become a well wisher. She's brought in so many other patients to us and making even them have the confidence in us that we can help them.
Yeah. And one more thing is we have to have a very much trust with the doctor whom you're going. See, initially do a research and select the doctors. We had one interesting patient here. What he does is he has seen 20 doctors for a simple sebaceous cyst in the body. Okay, he has
That
not.
must be very expensive.
Yeah, even for the consultation, he spent more than 30,000 rupees and multiple investigations. Also, sometimes even do scans for this diagnosing the sebaceous, which is not at all necessary. And finally, he's not going and getting treated by any. He finally land to us also, but the same thing. Very like always doubting the doctor whether he's cheating or not, whether he is going to screw up the surgery or not. Like this kind of a thinking process only in his mind. See, the simple advice to the clients, as I said, you take some time to select the doctor. But when you select the doctor, stick with the doctor, believe the doctors, don't change the doctor often, and follow their instruction properly. You'll definitely happy. Only thing is you have to see that whether vibes match, doctor, patient, that vibe match. Please go ahead and don't keep shopping around for the just doctor's treatment. It is nothing, not like other sari shopping or something else. This is doctor and treatment thing. So don't shop around a lot for the treatment.
Yes, I remember this patient in the OPD very fidgeting, very confused. I think it's very, very important that patients believe that their doctors, though are plastic surgeons, cosmetic surgeons, and see all kinds of strata of patients, but still we are ready to cater to anybody of any class. And you can come and trust your doctors and tell us freely your problem rather than going to many and not explaining what you really want.
And other interesting patients you remember, Dr. Joyce, that the family fight in the consulting
Yes,
room.
yes. How can I not? How can I forget that?
Yeah, the one young male patient came. It's not uncommon for us. Usually, the parents, like come here with the different ideas, and the kids come with the different ideas. So this patient, what happened is, he came and consulted for a arm tuck procedure. He lost a lot of weight. Very motivated patient. He was obese in the college time. He motivated himself and did a lot of diet and exercising, and he lost a lot of weight. So the arm skin become very lax and it's saggy. So he wants it to get corrected. So he came. A lot of discussion happened, and
He was under some addiction too, no, doctor?
yeah, see, that was not revealed till end of the consultation.
Yes.
Finally, my mother told that when we are asking about smoking, he smoked. As well as I don't know whether he smokes something else also. You asked doctor, kind of. He put the pressure on us. Then he said, yes, I am on other drugs also, cocaine and other things also. So then our discussion completely changed into a uh,
De-addiction.
de-addiction program, kind of. So we keep discussing about why he should not smoke, why he should not smoke marijuana or cocaine, what are the side effects of those things. We have to take him all the way down to infertility during the pregnancy and the birth defects for the kids. We have to make them understand why the smoking is so bad for him. And he's very young, he's 22 years only. We completely make him understand, and the big fight happened between the mother and the son in the OP itself. And finally, we make both of them understand why it is difficult to stop everything suddenly. So mother also have to help the son, and son also have to understand that feeling, because they want him to be healthy and happy. So finally they went happily, and they want to he wants to stop smoking completely and come back after 3 weeks time for the surgery. It's really interesting, this kind of helping somebody to come out. They come with some other problem. The idea of the cosmetic surgeon is not to just to make them happy in cosmetic surgery alone. You have to make them happy completely, not only along with the surgery what you do. That's what matters. Even after 20 years, 10 years, if the person think about you, a smile has to come. Like, he only made me like this. He only treated me and made me a good person, or stopped that smoking habits, like that. Like this, that is a good feeling what we get.
Yes, doctor. I'm sure everywhere we read that smoking is bad. It's even indicated in the cigarette box. But little do patients realize the importance of all of that. But for the benefit of the audience who are listening to us, could you tell us how the smoking can affect for the surgery for us in plastic?
The problem with the smoke is it has nicotine. That's the main problem for us. More than that nicotine, 500 chemicals are present in the smoke, whatever he smokes, marijuana or whatever.
Okay.
So the most of these chemicals in the nicotine, what it does, it constricts the blood vessels in the body. So for the healing, we need a good blood supply for the skin. Any plastic surgery, cosmetic surgery, everything is dealing with the skin. So the skin surgeries, when we cut and we suture it, or we do some kind of a manipulations in the skin, we need a good blood supply. If he smoke, it won't, the blood supply will be less to the area where we operate. So healing is delayed so much, and this is our healing part in the plastic surgery. But same time, for the anesthesia purpose also, if he smokes, the lung has a lot of complications. Anesthetists face a lot of bronchoconstriction, on-table collapse, and all those complications will happen during surgery. So for the anesthesia purpose as well as for the healing purpose, and we don't touch the smokers. At least 3 weeks they have to stop for a major surgery, and after surgery also 2 3 weeks they should not stop. They should not touch the smoke again. Usually we advise, okay, 3 weeks you stop, after that completely stop. That's what I advise the patients, and I'll tell them the same thing. 2000 diseases, our textbook contain 2000 diseases, mean 1500 disease, cause of the disease is smoking. Why you want to get with that smoking? And we have to make them understand the complications of smoking. I feel that at least 50% of the patients who listen to that my my talk has stopped or reduced smoke at least.
Yes, one very important thing in tissue healing is the collagen production, and smoking is supposed to hinder that. So it's very important that they stop. And also, we have noticed that these patients who are constant smokers, there's a lot of intraoperative bleeding, and it becomes very difficult along hours of surgery when we are trying to tackle with these patients.
So true. Yes, every time when we see a lot of bleeding, the first thing what we ask is,
Is this a
Dr. Joyce,
smoker?
is he a smoker? That's what we ask every time. Uh, good, good that we have just advised few people.
Dr. Karthik, this case was very interesting to me. Usually, I've seen women very particular about their calf shapes, and they come and ask for calf reduction. But this was one case where I saw a male patient coming in for calf reduction, which was very interesting. Always, we see male patients who want to build their muscles, go to the gym, and do in and out different kinds of exercises and make a more perfect physique. But here was one who was very disturbed with his calf size and wanted a reduction. Could you elaborate about that?
See, it's all depends on individual thing, and as I said, no, the bullying part. Okay, so this guy was bullied by his friends often about the calf muscle shape. Actually, it is a little abnormal only. Both the heads are so much bigger.
Okay.
So when he wears a pant, also sometimes it won't go beyond that area.
Oh.
So it's kind of a little weird, but usually, a lot of people they don't bother about it. But a lot of, as you said, the guys wanting to build the calf muscle, they keep doing the exercise and pump the muscle size. But this guy doesn't want it. As I said, no, the bullying matters a lot. So always we have to talk about the bullying in a separate session. But because the bullying, he got so disturbed, so he wants to get it reduced. Yes, we are planning for the Botox injection for the calf muscle bulk, and we want to help him. Probably he'll be coming next week for the Botox injection, though it's temporary. He wants to see how it looks then before going for a permanent surgical procedures.
Oh, that is something I'm looking forward to. I've not seen it before. We've seen Botox everywhere else, like for the face, but this was very
Though it's
interesting
not a
to see.
regular indication what regularly
Yes.
we do, but it really helps. I've done few other interesting areas also, like a neck. Like
Okay.
trapezius muscle bulk, make it look like a little manly. So the girls
Okay.
want that curve to be little, like slopey, and I've done there, and some more indication, some more interesting. Lot of places you never thought about it, but we have done, and patients are really happy.
So I think as cosmetic surgeons, we should not stick to only old school ideas like Botox means it's only for the face. Be ready to even incorporate your ideas and all your techniques even elsewhere in the body.
Next interesting patients, if you see that the rhinoplasty consultation is really like art, and I love to do it, and
And I like to listen to.
so true. And this rhinoplasty patient actually consulted me so many times. I'm telling, this patient came to me 8 years back, yes, when I started my career.
And I'm sure you're always very patient with them in each of the consultations because you believe that, especially these patients, need to be thoroughly counseled.
100%. You have to make them really understand what is the result going to be, and like you have to give a clear picture, the before after pictures of your patients already operated, and so that like they get an idea. Okay, this is how it looks. You should not like morph the pictures and show them. Actually, that is really a bad for you only. You can convince the patient for surgery, but you can't get, like the expectation level goes high. You can't make them happy.
Yeah, many of us keep asking, can you show us those before after pictures? How would I look? But I don't think that will truly speak how they will be after surgery, right?
Yeah, obviously. So only we never do that because it gives a false impression in the patient's mind. It never difficult to erase. After surgery, they'll be unhappy. You'll be unhappy. So this patient came 6 times, three, 4 times with me for the consultation. And finally, one day she came and said, "Doctor, my family is pressurizing me to go to other surgeon for surgery. Really sorry, but I'm very happy with your consultations." And she left and underwent surgery with other senior surgeon. And after that, she's kind of okay, but not completely happy with the surgery. So she comes back for after she doesn't want to touch the nose again, but all other procedures like a botox filler, small procedures. This time she came for some cyst in the face, for the removal of the cyst in the face. So she never left me for any other small cosmetic procedures. That is the trust what we build in the patient consultations. And always it bring back the patient as well as the relatives and the friends.
What I have seen is that one should not be very judgmental about patients. You should leave them free to go and even consult the other local plastic surgeons in a particular area that you're practicing, so that the confidence of the patient is finally earned and not bought.
So
So
true.
it was very nice that without any judgment, you've been catering to her other small needs. So that gives her a lot of confidence that though I did not get operated for him for rhinoplasty, but that doesn't mean that I cannot do other procedures with him.
So true. One other interesting story. One patient, we did a gynecomastia. So it's a huge gynecomastia, a grade 4 gynecomastia. Now we had a lot of other way to manage the loose skin. I'm telling 7 years back. That time we don't have that much things. We told him you might need a second surgery for a skin excision procedure and tightening procedure. So he listened to all of the stories, and he's not very much literate. And he's a kind of a the ministers that try to something like that. So one day he came and said that I'm not happy, doctor, that loose skin is there, kind of all those things. But I told him, as I explained earlier, you might need one more surgery. So please wait, we'll do it, kind of. Then he disappeared one day from the local police station. One constable came to me and said that inspector wants to meet you. I was wondering why, what happened. One patient came and complained to us. Then I went there. That guy is sitting there. Then like it's nothing to do with the police station. Actually, there's no role of police here. But like the police, because the minister's influence or something, that guy went to police and wanting to influence through the police, and made him understand. Finally, he came back for the second surgery and got corrected. After that, he's very happy and he apologized so many times. And then still he's in my Facebook and he follows me and he congratulates me for each and everything. So don't be so judgmental. Even this guy did it because of the illiteracy only, not because that he wants to like really damage me or something. His expectation. He hasn't understood the pros and cons properly. Probably even my mistake. I haven't put some more efforts to make him understand. So this is very common scenario. So never judge the patient. When you said that, I remember the whole story of this.
So, as young plastic surgeons, we should be ready to shift our OPD consultation even to police stations. So, be ready, everyone. Um, this is something very peculiar. As doctors, I think we make the worst patients. Most of us keep on stressing to our patients that you need to regularly follow up, come for the regular consultations, follow the post-operative advice. This is one patient that Dr. Karthik had operated a year back. She's a doctor and she underwent breast fat fill. And after maybe one consultation post surgery, she disappeared.
Yeah, the thing is, she was doing some course outside the state, and she wants to go back immediately. I made it completely. We like how we discuss more than the pros. We discuss the cons of the procedure. We say
Yes.
that the fat necrosis and fat cyst formation. All those things are very common in the kind of a procedure. So you need to come for the regular follow up. Even if you're somewhere else, you have to keep in touch with us, and you have to follow all the instructions. But she completely disappeared, and after like after the first OP, in the sense post surgery, one review she came after 4 days or 5 days, then she disappeared. And few weeks back, she said that I have severe pain in the breast. What to do? I don't know, kind of. And only the pain bring them back to us. Like till that time they don't even ready to come for a follow up. So finally, what happens is when she came, I can feel the fluctuant swelling. When we aspirated almost 100 ml of fat,
Yes.
100 ml of that cystic fluid. We can't say cystic fluid. It's actually a little bit kind of a necrosed, liquefied fat kind
Yeah.
of thing came out, and then only she was relieved. So luckily it hasn't got infected. If got infected, it would be a big problem. No, people never understand. You know, doctors are the worst patients as far as me concerned. And I always tell the doctors, when doctor comes to me for consultation, I tell them first one thing: you forget that you're a doctor till the treatment completely gets over. Don't even behave like a doctor. Don't take your own decisions. Anything you have to tell us, then only we can guide you better. That's the first thing I tell the doctor when they come for a consultation.
Yes, it's very important that they don't self medicate and self treat and leave it to the experts to do the needful.
Other interesting patient, that mother and son came for a gynecology consultation. No, usually, like it's very common scenario when the parents will come along with the son for a gynecology surgery. The parents' attitude is, how will I do something to avoid the surgery? The son's attitude is, I want surgery tomorrow itself. Do something about it. And he kind of keep his face so sad and keep us, in between the father, mother, and the son.
Yeah, and putting us in
Yeah.
a very tough position that we need to convince the parents for him.
This guy is very much convinced about us and he wants to go for a surgery. But mother is so much worried. Usually, mother's common question is, sir, because of hormonal imbalance, any problem happens during the marriage, in the sense sexual life, any issues happen. And this is a very common question they ask. I don't know where they get the idea from. But we have to patiently make them understand it is just a temporary hormonal imbalance happens in the 13, 14 years of the age. It nothing to do with the future, sexual life of the patient. All those things you have to make them understand. And same way, like they keep asking about all the complications. They want to know all the complications. What we can say is we have done more than 3,000 cases safely, but still this is a surgery. But you ask your son whether he can live with this problem lifelong. Definitely no. Even if you're not supporting him at this stage, they'll come back to us without your knowledge and get the surgery done. So please support him. It's really necessary surgery for him. That's what I always advise the parents. Uh, so that's totally, see, totally we understand that parents are so much concerned about the kids, but they have to understand their psychology also, the kids' psychology also, how much they are suffering because of this. So we have to take a little risk to get rid of these kind of cosmetic issues. So parents, most of the parents nowadays are understanding. It's really happy to see that.
And one more important thing to young plastic surgeons is that these questions, though we answer for every patient, it becomes very familiar to us. But for the patient, that is it is the first consultation. It's the first set of questions that they have to ask us. So we should not treat it as something which we have been hearing a lot or it is absurd. But we should take time off and explain to them patiently. And I'm sure, Dr. Karthik, you've had immense experience with respect to gynecomastia and all the questions. And every patient, every OP, I think you see more than 5 to 6 cases of gynecomastia. And all of them ask the same questions, and you're still patient with them, explaining the same questions and giving the same answers again and again. And I think that is something which I have to, plastic surgeon, a young person like me, has to learn. And all young plastic surgeons need to learn.
Actually, truly speaking, 4 cases fine. Fifth case, I feel little tired. This explain the same thing. So only what I did nowadays is I'll record all those questions and put them into video format. So before they come for a consultation, I'll ask my staffs to send the videos to them so that they'll listen to the whole video and come back. So it makes our job a little more easier.
But I'm still sure they want to listen the answers directly from your mouth.
Yeah.
So a very interesting week for both of us who are at different timelines of our plastic surgery career. Hoping to see many more such interesting and thought-provoking experiences in the coming week. Our patients make our day, and their happiness gives us so much energy to go on, and we hope to help more and more of them. Though we have spoken about many of our patients, but we have completely hidden their identity and masked it so that we don't violate their privacy.
Thank you, Dr. Joyce, for co-hosting the first episode of the Plastic Surgeon's Diary. And we hope to have multiple sessions like this, so that like when we like end of our career, when we look back our practice, nothing else to do, just listen these plastic surgeons diary continuously, so that whole memories will come back.
Yeah, and
Thank you
I'm
so much.
sure we'll have so many memories to recall when we listen to this. Thank you, everyone.
Thank you.